Good evening, guys. Dr. Mukul here, your orthopedic instructor here at Unacademy. So please just give me a thumbs up, say hello, hi, or just let me know your presence if you are there. I hope the audio visual is working well and we can get going. So fine enough. So this is a particular session, where I'm going to discuss a very important topic, scoliosis. Now this is an area that has been incredibly popular over past couple of years amongst the examiners. You get plenty of questions from this area, in various exams, maybe the NEET PG, the FMG, especially over the past couple of years. And that's what's prompted me to take you to a little bit of the details of this particular area, scoliosis. I think we can just quickly start up with the look at this very nice clinical question, because clinical pattern just the next pattern that you have to all prepare for. So this particular question, I'll just read it first up for you. So 13 years old female, she's come to you and she has a deviated trunk deformity. So I hope you can see this deviation of the spine here. Now you see this deformity, okay, you noticed this deformity a little ago, and now this girl is worried that it's becoming worse and she might have a bad prognosis. Now this particular deformity becomes more prominent as she bends down, and that's how she actually got to know that she has the deformity. She bent down to tie her laces and the deformity became prominent. But again, that worry, that will it become worse or not. So that girl has got the whole spine and the pelvic x-ray done. This x-ray is in front of you. Scan through it, have a good look. Okay. Now you have to tell me what would be the ideal treatment you guys would choose for this case. Okay, so this case of scoliosis, I would simply say, because there's a sideways bending of the spine, you can very well notice. It's a 13 years old female. The deformity becomes more prominent as she bends down. So all things clearly written in front of you, and now you have to help me out as to what would be the appropriate management. Would it be the spinal fusion that needs to be done, a surgical procedure, or would a brace go, like a Milwaukee brace? Or no, Milwaukee is not the exact brace, you should be going ahead with the Taylor's brace. Or no, this is just a kind of a postural issue. Just ask the girl to maintain a good posture, core strengthening exercises, spine strengthening exercises. So can I have few guys participating and helping me out with the answer here? So people who are watching, no negative marking in my class. So I would love that you guys should participate, because a mistake here would become a memory. Okay, so please put in your choices, guys. Please, you may communicate to me. And yes, even if it's not all clear to you, you're absolutely blue on what is scoliosis, like how do we manage or how do we handle this problem? Not a problem. I'll help you out with this. Okay, no issues. So I'll just help you out with this, guys. So first of all, what is scoliosis? Let me just define this up for you. We label anything as scoliosis when we find that there is lateral deviation in the spine that has crossed 10 degrees. So that's where we say that this is scoliosis. You should have at least lateral deviation in the spine that would have crossed more than 10 degrees. Now, grossly speaking, scoliosis can be structural or postural. Even bad postures at times could lead to deviation in these curvatures. Now this postural scoliosis, what you find that the curve that will disappear as you bend forwards. So you bend forwards, the curve disappears, is the postural variety. So that means all you need to go ahead with our postural corrections. In fact, this is a designated clinical test that's called Adams test, to see even if that it's posture only that's leading to this deformity. So that is what is happening in postural scoliosis. You find the curve disappearing on bending forwards. That's Adams test, and that tells you this is the postural variety. So all you need in postural scoliosis is postural control. Now the structural scoliosis actually is a 3-degree deformity. three-dimensional deformity. So what you find here in that coronal plane, as I've just told you, is the lateral deviation. But here in the sagittal plane, you tend to have an increased lordosis of the spine. And in the axial plane, the horizontal plane, as I would say, you would have an abnormal vertebral rotation. So I hope you've got my message that scoliosis is basically a developmental anomaly in the spine. There's abnormal development in the vertebrae. They are rotated abnormally. There's increased degree of lordosis and there is lateral bending. All three as structural defects to call something as scoliosis. Now, if someone has structural scoliosis, how would you classify or categorize which part of the spine is having the deformity? Now, for this, you have to decide upon that this is the primary curve and these are the secondary curves. So, what is primary and what is secondary curve? I'll tell you. Primary curve is basically the central curve of the deformity, and these secondary curves are basically the compensatory curves. These are above and below a primary curve. So just understand this point here. In order to say that this is a thoracic scoliosis, you have to see that thoracic spine having a bending, but you have to find a compensatory curve below in the opposite direction, a compensatory curve up in the opposite direction. So when you only see the compensatory curves, you know which is the central curve, and that central curve is the primary curve, and primary curve tells you which part of the spine has the scoliosis. Like this particular diagram, it's the thoracic scoliosis. I'll just go back a little here. So this is the dorsolumbar spine having the scoliosis. So there's a compensatory curve here and there's a compensatory curve almost ending up here. So that's how we decide that what scoliosis, what part of the spine is having the scoliosis. Now once you know that you're dealing with scoliosis, what do you expect the patient to come to you with? Well, of course, patient can tell you that there's a trunk deformity, but then you also have to ascertain that what the patient is telling you is actually appropriate. So what kind of clinical features would these people come to you with? Now, if there will be a spinal deformity, this plumb line, we call this a plumb line, a vertical bit drop from the center, would not be crossing through this natal cleft. The shoulders would not be at a symmetrical level. These arm spaces would be unequal. So when we find a shoulder asymmetry, a plumb line that is not central, and arm spaces that are unequal, that is where we doubt that this patient would be having scoliosis. So I hope you are pretty much clear with the clinical features. Another very useful clinical feature is the identification of what you call as a rib hump. Rib hump. Now just understand, rib hump is a very gross kind of a word, I would say. Technically, this particular word, we call it scientifically a razorback. I'll tell you what is a razorback. See, as you bend forwards, okay, you find crowding of ribs, and this crowding of ribs occurs on the convex side of the curve. I'll just show you convex side of the curve. So this would be the convex side of the curve. You will bend and you will find these ribs having crowding on the convex side of the curve. This is what gives rise to this razorback or rib hump. I think I just told you about Adam's test. Or I think I can just discuss this question with you. This question was there in the AIMS paper, last year. All of the following, which of the following method can be used to screen school children for scoliosis? So what you're supposed to do, school children, you're supposed to decide, are you dealing with a postural scoliosis or are you dealing with a structural scoliosis, so that you can refer this child to a doctor. So that's what you do in such cases. You ask these children to bend forwards. You ask them to bend forwards. Because what will happen as these children will bend forward, if it will be the postural variety, you will find the curve disappeared, gone, and if it will be the structural variety, you will rather find the rib hump. So the findings are absolutely different in the two varieties of the scoliosis where you ask a person to bend forwards. In fact, that's exactly what I told you, Adam's test. So I think perhaps it's making sense to you, the relevance of Adam's test, or why screen school children, because even postural issues can lead to scoliosis. But in that case, you ask the person child to bend forwards, the curve would be gone. You ask the child to bend forwards, a rib hump becomes prominent at the back. That means you're dealing with structural scoliosis, because the child will bend forward, there will be crowding of ribs on the convex side, and you will find this rib hump. Clear enough? So clear with the logic behind Adam's test, guys. Any queries from the area that I've covered till now? Any queries from the area that's already been covered? Alright. Now if you're till here with me, now what else we want to know in this child? First of all, we want to grade the severity. How severe is the disease? And second thing, we want to know the risk of progression. That even if this is not severe, will it progress and become severe? The two crux things. Because based upon these two things only, would we be able to go ahead and decide the treatment? So how to grade the severity? By calculation of a very important angle that's called a Cobb's angle. So this is the curve, the primary curve. So your first step is to define the primary curve. So see the secondary curve above, compensatory curve below. So this is the primary curve. Now if you see the two lines here, the top line, this is a line along the topmost vertebra of this primary curve. Okay, and if you see this line, the lower one, this is the line along the bottommost vertebra of the primary curve. You draw a line along the topmost vertebra, you draw a line along the bottommost vertebra. So an angle is formed. This particular angle is called Cobb's angle. And this is an angle directly proportional to the severity. Means higher the angle, severe is the disease, means higher is the angle of the curve. So pretty much clear, guys, how to decide about the severity. Now how about predicting the risk of progression in scoliosis? But in order to to define the risk of progression of the curve, you have to move ahead and proceed with something that's called risers grading. Risers grading. So let me just brief you as to like what exactly is this risers grading. Okay. Now first, please understand. This is the ilium, and what you can see right on top of the ilium, this is iliac apophysis. Iliac apophysis. Okay, I'll just try to show the two things to you on an original X-ray. So that will be the ilium, and that will be the iliac apophysis. Now as you proceed towards skeletal maturity, you are growing. iliac apophysis will keep on fusing with the ilium, fusing with the ilium, fusing in the ilium, and then a time will come when this complete iliac apophysis will be fused with the ilium. Complete iliac apophysis is fused means your growing period gone. So that means growth in the body is over. So this is what is telling you there will be no risk of progression, because when there is no growth, a curve cannot progress. Scoliosis is a developmental anomaly of the spine. So as you are going to grow, it is going to progress. So that is how rises grading helps you in predicting the risk of progression. You have to see how much of iliac apophysis is fused with ilium. So I'll just write this down for you. See the extent of iliac apophysis fused with ilium. Clear? And based upon this fact, grade. See, a little fused, grade 1, 2/3 fused, grade 2, almost half fused, grade 3, more part fused, grade 4, grade 5, full fusion. Now the formula is very simple. You are finding more of fusion. That means higher grade. That means less of the growth is left. That means less the chances of progression. So higher grade, less progression, inversely proportional. See, Cobb's angle is directly proportional to severity. More this angle, more the chances this curve is bad. A higher grade means more of iliac apophysis fused, so less the chances of progression. So clear with this fact, guys? Because these are the points that help to decide the treatment in a case of scoliosis. Every case you have to calculate the Cobb's angle and you have to calculate the riser's grade. Same. Cobb's angle, riser's grade. Now when you find the Cobb's angle has crossed more than 45 degree, means it is severe. Or where you find the riser's grade is low, it's 1, 2, grade 1 or 2. This is where there is a high chance that this curve is going to become worse and troublesome. This is where you opt for surgical procedures like spinal fusion. You fuse the spine so that the growth would not exacerbate the deformity. But there may be another scenario where you find the Cobb's angle is less. It's not a severe curve. And where you find the riser's grade is also like grade 3, grade 4, grade 5, little towards higher side. So not much of growth is still left and pending. So this is the scenario where you can opt for conservative treatment. And conservative treatment here basically means braces. We have some special braces available for people with scoliosis that help to tone down, tackle down the progression of the deformity. So I hope you are pretty much clear with how to decide even treatment in scoliosis, when to use the braces and when to use the surgery. Braces, yes. This particular question again came up in the JIPMER paper, but this picture of this brace came up in the FMG paper. So again, very popular brace. This question came up that true regarding the brace that is shown in front of you. Any idea, guys, which is this brace? Any idea? Anyone who can help me out with the name of this brace? I'll tell you. This brace is named after its city of invention. This brace named after the city of invention. So can you help me know which is this brace? Alright, not a problem. I would help you out, with the important braces that we generally use in these people who tend to come to us with scoliosis. Well, 3 really popular braces we generally advise for these people. One is something called a Milwaukee brace. Then there's something called a Boston brace, and there's something called a Charleston brace. Now the greatest advantage with the Charleston brace, generally good enough even if you wear it only during the night times. So suffices within the nighttime wear, and that's an incredible advantage, because these braces, Milwaukee and Boston, they have to be worn for more than 20 hours per day, and that's a huge time. So Charleston brace is particularly popular because it's just having a nighttime wear, but cost is pretty high, so that is the negative factor, because most of the people, they cannot afford it. They're on that poorer side. So the alternative that remains for them are the Milwaukee and the Boston varieties. Now the advantage particularly with the Milwaukee brace. See, Milwaukee, a place in America, Boston, a place in America. So these are basically braces named after the places in America. Now the advantage with this Milwaukee brace, okay, it's going to offer to you the best correction. And the reason is very simple, because it's carrying the heaviest profile. So if something carries the heaviest profile, it's going to offer to you the best correction. See here, it's extending to the neck. There is a pelvic mold, and there are these lateral pads to pressurize the bulging areas and make the spine go straight. So you have pelvic pads, you have lateral pads, you have neck bands. So it's a very heavy profile. So obviously it will give you the best correction. But it's not going to have a good tolerance, because wearing it for 20 hours a day is difficult. So that's why the most commonly used brace tends to be the Boston brace, because here you get the perfect balance. A relatively much lower profile. So very comfortable to wear, and then gives you a reasonably good correction. So good enough correction also comes, and relatively a much lower profile to tolerate. So by and large, most popular among the orthopedic surgeons tends to be the Boston brace. So that's what we are in the habit of advising. So even if you see this patient here, look at the profile, so comfortable, can be worn for 20 hours a day, but this Milwaukee brace, difficult. So these braces are what we opt for in those scenarios where we want to proceed with the conservative treatment after the calculation of the Cobb's angle and the Reiser's grading. Let me now return back to this question. And now I think with the principles of scoliosis clear to you, this particular question will make sense. So this is the curve for you. Okay. So there's a compensatory curve going above like this, and this curve is tilting into a straight posterior compensatory curve below. Now considering that maybe this is the topmost vertebra of the curve here, and maybe this is the bottommost vertebra of the curve here, you can say what I've drawn over here is likely the Cobb's angle, and this will be around 40 degrees, I suppose. And look at this iliac apophysis. I'm sure you can see the complete iliac apophysis. It's not fused with the ilium. Just a little part of it has. So much of it is waiting to be fused. So that means the riser's grade here would be pretty low. Maybe grade 2 or so. And this Cobb's angle, maybe like 35-40 degrees. So the Cobb's angle is relatively high. And the riser's grade is relatively low. Cobb's angle is high means there is good amount of severity in the disease, and riser's grade is low, so that means there is a good amount of risk of progression. So both things not favorable. So guys, I don't think I now need to tell you that if I would be the treating surgeon, 13 years female, she might grow till 18 or 19 years. Some good amount of growth is pending. That rises grade is just grade 2, and then that severity is also not very good. It's little towards the higher side. So now my preference would go on to a spinal fusion surgery. Taylor's brace. Dorsolumbar spine fractures. That's where we use the Taylor's brace. So that's nowhere choice here. Had these things been on the lesser side, Cobb's angle less, rises grade high, I would have gone with the brace treatment. And had you've not had this thing, the curve becoming more prominent as the girl bends down, telling you that this is the structural variety, that rib hump coming up as you bend down, I would have gone with this option. But this is not the correct option, exercises, because this is not a postural problem. On postural issues, the curve disappears as you bend forwards. Adams test. So I hope good enough information given in the question. A very clear and a nice picture showing you all the parameters, and a good interpretation showing you the decision making process in case of scoliosis. So I hope guys you're thoroughly clear with this, you're thoroughly clear with all these things. So as I just pack it up, finish up the lecture, just showing you an interesting image. This was the kind of treatment we used to have when these modern braces were not there, and we would be hung up in such a bad type of plaster. This is a Minerva jacket, and this is what we used to do in people who would actually come to us those days long with that cervical kind of a scoliosis. So that is the trend of change orthopedics has seen with those modern implants, with that wonderful technology we have with us, with the wonderful prosthetic materials, orthotic materials we have with us. Okay, all these tough plasters have changed into nice, easy to wear braces with some wonderfully good clinical results also. So I hope I'm thoroughly, I've been able to make you thoroughly clear with this little tough topic, scoliosis. At least I've been able to give you how to decide upon the treatment part, how to grade the disease, how to predict the risk of progression, how to identify which part of the spine has this scoliosis. So clear enough guys? Any query for me, anything you wish to ask me? Alright, I suppose most of the things were clear to you, but yes, in case you wish to read more from me, the best way is that you take your Plus subscription, because you tend to get all the benefits with the Plus subscription. In case you want to maximize your benefits, go with the Iconic subscription. Iconic. I hope Unacademy and Prep Ladder joint venture. They're a joint venture. So you can get both the subscriptions at very economical prices, and then you can have advantages of both. Fetch them up, okay, together. I'll just let you know about another very interesting feature. That's really going to benefit you in case your exams are just coming up. In case you wish to use notes for a quick recap of all the subjects, then with these subscriptions, if you're taking an year plus subscription, you can also get access to these notes for all subjects. That's a wonderful feature that's been added up for all the subjects. Okay, so make sure you make use of it before the price hike comes. There are some special test series also for you, because you're preparing for your MCQ exams. So just a list of few test series. Do see here February 27, you have the grand test FMG 22. You can also go through all the previous year questions. That batches is coming up, PYQs. Okay. Some batches coming up for the FMG and NEET exams. So starting in March, this batch will focus on the FMG 2022. This is for the FMG 2022 comprehensive batch, 9 months course. The next 2023, again starting on March of 2nd. This will be a subject wise batch. Every subject will be taken up in detail by various educators. All educator revision batches also on the go. So people who are appearing in the NEET PG that's just been deferred by a couple of months, in case you're feeling a little bored with nothing much to help you out through this all educators revision batch is the one for you. So please get set to take your subscription. You will have all the 40 plus educators the wonderful team we have at Unacademy in one go, giving you all the last minute high points. How to subscribe, I don't think I need to tell you, you are very much aware. You just have to log on to the website and just make the payment and subscribe and take your subscription. Make sure you use this code OrthoLife to get you 10% off in case you are subscribing. Fine. So that's all. So any confusion, any queries, guys, you want me to apprise you with, clear for you in before I just end up the session? Okay, so I suppose no queries. So just again writing the up in the capital letters my code OrthoLife. So fill in this code to get you 10% off on the subscription price. So although the subscription prices in itself are so meager, you further put in this code, get you 10% off. So I wish you all the best. See you again for some more special classes. Bye bye.